Welcome to The Explainer. Today we're tackling a topic that's often misunderstood, traumatic brain injury, or TBI. But we're focusing on a specific group, older adults. And as you'll see, researchers are calling this a hidden and frankly a growing epidemic.
All right, let's start with a quick thought experiment. When you hear traumatic brain injury, what's the first image that pops into your head? For most of us, it's probably a young athlete, right? Or maybe someone in a serious car accident. And for a long time, you'd be right. But that picture, it's changing a lot.
So let's dive right into that shift, because the data shows something pretty surprising. A trend that's basically flipping everything we thought we knew about TBI on its head.
Okay, take a look at this. This chart, it just shatters those old assumptions. Yeah, you see a high rate for really little kids, 0 to 4. But look all the way to the right. The biggest bar, by far, isn't young adults. It's older adults, 75 and up. They have the highest rate of TBI-related hospital visits and deaths. That's a massive demographic shift, and it has some huge public health implications.
So you gotta ask, what's behind this? What's driving this huge generational shift? Well, it turns out the main cause isn't what it used to be. It's not the big, dramatic traffic accidents anymore. Nope. It's something that sounds almost ordinary. Low-level falls, a slip in the home. And that change in how these injuries happen is just as critical as the change in who they're happening to.
Okay, so this isn't just a bump on the head. Let's really dig into the scale of this problem, because we absolutely cannot afford to write these injuries off. A TBI that might seem mild on the surface can be, well, devastating for an older person. Get ready for this number. 16%. A huge, and I mean huge, recent study of over 2 million patients found that 16% of older adults with the TBI die in the hospital. That's 1 in 6. And listen, that's not just for the worst cases. That's across the board, for all types of TBI. Now let's break that down, because this is where it gets really stark. Look at the so-called mild TBI. Even there, the mortality rate is 5%. That's not nothing. But watch what happens. For a moderate TBI, it jumps to 18%. And for a severe TBI, it just skyrockets, 65%. That's just a staggering number. And it's serious when the experts themselves are stunned. The researchers who did this study, their words to describe these numbers were shockingly high. When the people doing the research are shocked, we've got a major problem on our hands. So what's the bottom line here? It's this, and it's crucial. Even a mild TBI, one that we used to think wasn't a huge deal, is a major independent risk factor for death in an older person. That completely changes the game for how doctors have to think about and treat these injuries.
So why? Why is it so different? What makes a TBI in an older adult a totally different beast for doctors? Let's get into it. Okay, so you've got 2 columns here, and the differences are pretty stark. For a younger person, the cause is usually something high impact, like we said, a car crash. And doctors have tools like the Glasgow Coma Scale that give them a pretty reliable read on how bad it is. But for an older adult, it's a whole different story. The cause is often a simple fall. And the tricky part is, those same standard tools, they can be misleading. They can make an injury look less severe than it actually is, all because of changes that happen in the body as we age. And that brings us to a really important word here, frailty. Now, this isn't just about how old someone is in years. Think of it like a reserve tank. Frailty means that tank, both the physical and the mental one, is running low. So when a huge stressor, like a TBI, hits, there's just less in the tank to fight back with. That's why someone's level of frailty is actually a much better clue to how they'll do than just the number on their birthday cake. Now, all these unique challenges, they can lead to a really dangerous way of thinking in hospitals. A mindset that can literally mean the difference between life and death. There's a name for it, prognostic nihilism. It sounds complicated, but it's simple and scary. It's this fatalistic idea, this assumption that just because a patient is old, a bad outcome is a sure thing, and that becomes a dangerous self-fulfilling prophecy. It can lead to decisions to stop life-sustaining treatment, not based on what's possible, but based on a pessimistic assumption about age.
But here's the thing. The actual evidence screams the opposite. Expert guidelines are crystal clear on this. They state that age alone is not a reliable predictor of mortality or functional outcomes. Let that sink in. Your age is not your destiny. Good outcomes are absolutely possible.
So, if we toss that nihilism out the window, what's left? What does a better path look like? Well, it's about making a fundamental shift away from making assumptions and towards working together. There's a great model for this called the SHARE approach, and it's all about making decisions together. It's not just the doctor deciding. It's a whole process. You seek out what the patient and their family think. You help them understand all the options. You really try to get at what the patient's values are, what they would want. Then you make a decision together. And it doesn't stop there. You keep evaluating it. It's a conversation, not a command.
And this isn't just theory. Here's a real-world case that shows how powerful this is. Picture this. A 90-year-old man, he's got a lot of other serious health problems, and he gets a severe TBI. The old way of thinking might have just given up, but not here. The medical team worked closely with his son using that shared decision-making process. He had surgery, then another, less invasive one. And after 4 months of hard work in rehab, this 90-year-old man went home. It shows what's possible.
That's an incredibly hopeful story, right? But it also shines a bright light on how much we don't know. This rise in TBI among older adults, it's forcing us to ask some really urgent questions, not just for doctors, but for all of us.
You can see here, researchers have a lot on their plate. There are huge gaps in our knowledge. How can we diagnose severity better? Maybe with blood tests? Who should actually go to the ICU? What kind of rehab works best for an 80-year-old versus a 20-year-old? And here's a big one. How do you tell the difference, down the line, between cognitive problems from the TBI and something like dementia? These are the big, unanswered questions.
And that brings us to the final and maybe the most important question. This whole issue, it's not just about data or medical procedures. It's bigger than that. It's a human challenge. As our world keeps getting older, are our healthcare systems ready? Are we ready to see the person, not just the number on their chart? Are we prepared to look past their age and focus on who they are, what they value, and their very real potential to recover? How we answer that question, well, that's going to shape the future of care for millions.